Good night. My name is Daniela Tobalina and I'm going to talk about Case 16, 2017, a 69-year-old woman with urinary incontinence. First of all, I'm going to talk about the definition. Urinary incontinence, the loss of bladder control, is a common and often embarrassing problem. The severity ranges from occasionally leaking urine when you cough or sneeze to having an urge to urinate that's so sudden and strong you don't get to a toilet in time. Though it occurs more often as people get older, urinary incontinence is an inevitable consequence of aging. For most people, simple lifestyle changes or medical treatment can ease discomfort or stop urinary incontinence. How to explain urinary incontinence?
How to explain urinary incontinence? Urinary incontinence is involuntary loss or accidental release of urine. Some women may experience accidental release of urine while they are running, coughing, or sneezing. This problem is commonly seen in older adults. Though there is no harm with this, it can be embarrassing. Women who suffer incontinence may keep away from enjoying activities with their friends and family to avoid public embarrassment. Urine incontinence problem is more in women.
Next, I'm going to talk about the applications in medicine. The American Urological Association's 2012 guidelines for managing overactive bladder emphasize that behavioral therapies and lifestyle changes should be the first treatment approaches. It's important to determine the type of urinary incontinence that you have, and your symptoms often tell your doctor which type you have. That information will guide treatment decisions. Your doctor is likely to start with a thorough history and physical exam. You may then be asked to do a simple maneuver that can demonstrate incontinence, such as coughing. According to a recent study, drugs for urge urinary incontinence only help about 20% of the women who take them and often have significant side effects.
We'll partner with the patient to discuss the different options available, both surgical and non-surgical. Once the options are laid out, it's really up to the patient to decide how she wants to proceed with the treatment. There are therapies such as physical therapy, medications, and dietary modifications that can be used to help treat urinary incontinence. Physical therapy would be teaming a patient up with a physical therapist trained in this type of therapy, where she would teach you how to strengthen the pelvic floor muscles to make them stronger, and so you would have better bladder control. That type of therapy can be extremely successful. Medications are available for these conditions. Depending on the type of incontinence the woman has, would help tailor the type of medication that she would need. Behavioral or dietary modifications can also be quite useful. Looking at one's intake of food and fluids and the type of fluids one consumes, such as caffeine or alcohol, can have a tremendous effect on the bladder function. All of the surgeries available at Christiana Care are surgeries that take between 15 to 20 minutes and are outpatient surgeries. Very often the patient can be back to work within 1 or 2 days, and the downtime or recovery would be very quick. The surgical treatments can be extremely successful with cure rates upwards of 75 to 80%, depending on the type of surgery and the situation that the patient is in.
Now I'm going to talk about the issue applied in Ecuador. In our country, because of the lack of importance people are given to this topic, the problem intensifies in a worrying way. One of the causes is a lack of information, which has led the patients to hide their problem, or it has brought them to think that this sickness is age-related, situation that takes this person to a social isolation. According to Roberto Diegues Dacal, a geriatrics expert, the elders are very afraid that the society starts to laugh at them because of urinary incontinence. Adolescents also suffer when they have problems controlling their bladder. Just 50% of the elderly population that goes to a consult let their doctors know that they have incontinence, and the other half does not tell them and try to solve their problem themselves. In Ecuador, it is estimated that the prevalent prevalence of urinary incontinence between the ages of 15 and 65 years old is 10 to 30% in women and 1.5 to 5% in men.
Do suffer from weak pelvic floor muscles. It's a very prevalent issue. In fact, over 21 million American women are thought to suffer from some form of incontinence. It's really important to know that the average woman waits 8 years before she tells anybody about her leaking. And it's even more interesting to know that women who leak a little bit like that don't even consider themselves incontinent. They often think that people that are incontinent have to wear a Depends or a diaper, and if they're just wearing a little panty liner for a little insurance protection against a few drops, they don't consider themselves incontinent. Mild urinary leaking can really affect women in any age group. In fact, there's been studies that show 20-year-old elite athletes, even 38% of them, leak some amount of urine. Women after childbearing, after vaginal deliveries, maybe they had some damage to the pelvic floor muscles during the delivery, or even just from the weight of the pregnancy. And then as we age and become menopausal with hormonal changes, we can experience more issues with leaking and mild sagging of those organs. Some women think, oh, well, this is just a normal part of life and I just have to deal with it. Or they think surgery is the only way to treat it and they're afraid of that, so they just deal with it. So it's really important to reach these women and let them know there are early interventions to prevent leaking before they go on suffering year after year with leaking a few drops, because this can become a real quality of life issue for them. Kegel exercises really are the #1 prescribed doctor recommended treatment, because mild urinary incontinence and prolapse are treatable and resolvable. And Kegels are a first line of defense for that. There's negligible risk, they're easy to do, and there's no side effects.
And now I'm going to talk about the pros and cons. Pros. A course of treatment for urinary incontinence can improve stress and urge urinary incontinence in women. It can also improve urinary incontinence in men after surgery to remove the prostate gland. Exercise may be helped with electrical stimulation, biofeedback, or vaginal cones in women. And medication can improve stress incontinence if the above treatments do not work, and surgery is either not possible or not desired. Cons. Urinary incontinence is a complex syndrome with multiple causes. It is not uncommon for individuals to experience more than one type. Taking medication may be not suitable for everyone. Its common side effects include nausea, dry mouth, fatigue, and constipation. And it can cause unpleasant symptoms if you stop taking it suddenly, so it needs to be withdrawn gradually.
Overactive bladder has a number of treatment options, that being conservative therapies and then our surgical therapies. And really on our surgical therapies, there's two treatments that we frequently do. One is Botox injections for the bladder, and the other is InterStim therapy. And there's pros and cons to both. For Botox, the great thing is it's just done in the office. It takes about 5 minutes to do. And patients do not have to prepare for anything beforehand and are able to drive themselves into the office and then leave right afterwards. Some of the things we worry about with Botox is that there is a chance of getting a bladder infection, so we will give patients antibiotics right after the procedure to prevent it. And the other thing we worry about is urinary retention, not being able to empty your bladder afterwards. That rate's pretty low. It's around 5%. And we usually start with the lowest dose, so it probably brings that risk down even lower. InterStim therapy is interesting because it's one of our truly reversible therapies. So we can test the patient to see if it's going to help them before we actually operate on them and put the unit in. So you can do a 1-week test, which can actually just be done in the office, and then they go home with this little lead or electrode that's just taped to them that they wear for a week to see if the therapy helps them. Another option is a 2-week test, where in the operating room we put the permanent lead in and then test them for 2 weeks. During all those testing phases, we're interacting with the patient, trying to decide if it's the right therapy for them. Botox will last anywhere from 6 months to a year before you need repeat injections. InterStim therapy, the battery life is from about 3 years to 5 years. They're both great options. You don't have to do one before the other, and certainly you should discuss with your provider which one's the best one for you.
And finally, to conclude, you may feel uncomfortable discussing incontinence with your doctor, but if incontinence is frequent or is affecting your quality of life, it's important to seek medical advice because urinary incontinence may indicate a more serious underlying condition. It can cause you to restrict your activities and limit your social interactions, and it can increase the risk of falls in older adults as they rush to the toilet. Thank you very much.